Welcome, and thank you for choosing Oasis Health Partners and trusting us with your care. We know that recovering after an acute illness can feel overwhelming, and that coming home doesn't always mean everything is back to normal right away, and that's exactly why we're here. Our care coordination team will be with you every step of the way so you can heal safely and comfortably in your own home. Today, I'd like to walk you through what to expect, so you know exactly how your care gets started and who will be helping you along the way. Before we get into the details, here's a quick overview of your full home health journey from start to finish. It begins with your referral. From there, we verify your insurance, coordinate your transition of care into the home, and make a welcome call to introduce your team. Then your ongoing home health visits begin, and finally, once you've met your recovery goals, you're discharged from home health. Each step is designed to make your care as smooth, safe, and supported as possible, and I'll walk you through each one. The first step is your referral. This is where everything begins. We receive an order from your hospital, your case manager, or your physician that outlines the specific home health services that have been ordered for you, based on your medical needs. You don't have to do anything to set this up. It comes directly from your care team. Once we have your referral, we can begin getting everything ready for your care to start. Next, we verify your insurance. Our team checks your eligibility, your covered services, supplies out of pocket versus insurance coverage, any prior authorization that's needed, and any copays, so there are no surprises before your care begins. We do this one of two ways: electronically, through your health plan's online system, or by calling your health plan directly. Either way, we handle all of it for you, so you can focus on your recovery instead of paperwork. This step is what we call your transition of care, and it's one of the most important and most complex parts of what we do. Depending on where your care begins, this may involve coordinating your discharge from the hospital or working directly with your physician's office. As you can see here, our care coordination team works with everyone involved in your care: your doctors, the hospital case manager or social worker, the pharmacy, medical equipment suppliers, your insurance, your nurses, your therapists, our home health social worker, and most importantly, you and your caregiver. Our job is to bring all of these moving pieces together so your transition into home health is seamless and nothing falls through the cracks. Once everything is coordinated, you'll receive your welcome call. A care coordinator will reach out to confirm your address, your insurance, your medications, any allergies, and your emergency contacts. This is also your chance to ask us anything. No question is too small. This call is how we make sure we have everything right before your first visit, and it's the start of our relationship with you. Now we assign your nurse. Once your intake is complete, we carefully match you with a registered nurse who is the best clinical fit for your needs and who serves your area. Your nurse will reach out to you directly to introduce themselves and to schedule your very first visit, which we call your start of care visit. One important thing to know: your nurse is always the first clinician to see you. No other service begins until after that first nursing visit. Your start of care visit is when your care officially begins in the home, and your nurse will take care of a few key things. First is your admission paperwork, consent, HIPAA, your patient rights, financial responsibility, and emergency preparedness. And your nurse will explain each form before you sign anything. Next is a comprehensive assessment, where your nurse reviews your medical history, medications, discharge instructions, and completes a home safety review. And finally, your nurse builds your plan of care, an individualized recovery plan based on your personal goals. By the end of this visit, you'll have a clear picture of your care going forward. After your start of care visit, any additional services your physician ordered will begin. Depending on your needs, this may include physical therapy, occupational therapy, speech therapy, a home health aide, or a medical social worker. Each clinician will contact you directly, either the day of or the day before, to arrange a convenient visit time. And visit windows are usually about 2 hours. If we're unable to reach you, we'll do our best to reschedule at your earliest convenience. But it's really important to respond to our team, because staying in touch is what keeps your visits on schedule and your recovery on track. Throughout your care, our whole team stays coordinated and in constant communication with each other and with your physician. If anything about your condition changes, your nurse will contact your doctor right away to get any additional orders you may need. This keeps your recovery on track and your physician fully informed. You're never managing this alone. We're working behind the scenes for you the entire time. Here's what you can always expect from us. First, dignity and respect. Compassionate, non-discriminatory care that honors your rights and your privacy. Second, transparency. You'll always be kept informed and involved in planning and reviewing your care at every stage. And third, high-quality care. All of our services follow established safety standards and will address any billing or insurance questions promptly. This is our promise to you. Just as you can count on us, there are a few things we ask of you to help your care go smoothly. Please share complete and accurate health information, including any changes to your medications or physicians. Let us know in advance about any scheduling changes or updates to your contact information. And please help us maintain a safe home environment and take care of any financial responsibilities we discussed before services begin. When we work together as a team, you get the best possible care. You can reach us anytime. For urgent needs, call our office at 786-558-5148, and we're available 24 hours a day, 7 days a week. For non-urgent questions, feel free to text us at 305-588-2411. Now, home health is temporary, and at some point your services will come to an end. When your recovery goals are met, your nurse will review the Notice of Medicare Non-Coverage, or NOM-NC. This is a notice that's required for every patient before discharge, regardless of your Medicare status, and your nurse will present it to you at the visit prior to your discharge. It confirms the date your services will end and explains your right to a fast appeal if you disagree with that decision. We'll make sure you fully understand your ongoing care plan before we say goodbye. From your very first phone call through your final visit, please remember that you are never alone. Our mission is to provide compassionate, coordinated, and exceptional care that helps you recover safely at home. On behalf of everyone at Oasis Health Partners, welcome to our family. We're honored to care for you, and we look forward to being part of your recovery.